Hi, everybody. I'm Vinny from Hey Doc. I'm a physician here in Brazil, and welcome to our podcast. I know, Hey Doc's supposed to be written with an H, but you're in Brazil, babe. So that's how we roll. Today, I have a very special guest. He's a friend of mine. He's a great person, and we're going to talk about how to design youth mental health services for young people and with them. We have with us here today Dr. Steven Adelsheim from Stanford University. I'm going to introduce him. He has a huge bio because he's done so many things, but I'm really going to try to stick to it. Let me just ask if Steve has a question at this point. Okay, so the bio is like huge. Really, it's like half a page, but I'm going to keep it short. So I'm going to read the first and the last sentence. So Dr. Steve's a child, adolescent, and adult psychiatrist who works to support community behavioral health partnerships locally, regionally, at the state level, and nationally. He's done many things. You can check it out. You can type his name on Google. There's the full bio over there. But he's currently leading the U.S. effort to implement the headspace model of mental health early intervention for young people aged 12 to 25 based in Australia. And Steve also leads the National Clinical Network for Early Psychosis program called PEPNet. Thank you so much for being with us here today, Steve. I'm so excited. I've been talking about this conversation the whole week. Every friend of mine knows that we're having this conversation today. Literally, everyone's like, okay, we're gonna talk about youth mental health services. So let me just pass the word to you to say hi to everyone.
Benny, thank you so much. It's an honor to be here with you. I'm really grateful to be able to have this conversation with you, and I really appreciate your enthusiasm, man. It's great.
Okay, awesome. Let's do it. We're really gonna start with one very simple question, just to get people, acquainted with you, because you're like, who's Vinny? Who's Steve? I mean, people know me a little bit because they probably heard like one or two episodes at this point, but maybe people aren't very acquainted with you. So we really just want to set the scene. So my first question for you is, could you just share a little bit of your journey? I mean, how you became passionate about working in the field of youth mental health? Like, what was your journey until this point? Just so people know a little bit more about you.
Thanks, Vinny. So I actually am one of those people that is pretty unusual in that I decided in high school that I really wanted to do youth mental health work. And the truth is, I'm not exactly sure how that came about. I'm the oldest of three kids. I grew up in Pittsburgh, Pennsylvania, and I really got interested in initially how the brain works and in mental health related issues, and ended up spending time in high school studying psychology at the local university because they didn't have classes where I went to high school, and then when I went to college, I decided I wanted to be a child psychiatrist, and so I was a pre-med psychology major. I took a lot of courses on youth development and sort of kept going in that direction. I finished college, and while I was applying to medical school, I worked on an adolescent inpatient psychiatric unit for a year. And then I decided before I went to medical school, I was going to go do work in rural communities. So I went to Alaska in the United States and worked in very rural indigenous communities, flying around in small planes and working in schools and villages ranging from 50 to 400 people and doing stuff with the kids in the schools. And then I went on to medical school and then residency in psychiatry and child psychiatry. I did that in New Mexico. I became the father over time of 4 kids who now range in age from 36 to 22. And I'm now a grandfather of 1-year-old.
Wow, congrats.
Twin boys. And so, that's a little bit about me. I really have been pretty straightforward in my focus on this work. over time, and have been grateful to be able to have had a career, on work that I really love doing. I'm one of those people that was lucky enough to have this idea of what I wanted to do, and it turned out to be accurate, and I've been able to continue to do it in lots of different and exciting ways, and I've been grateful for that.
Wow, that's so nice. I mean, that's so interesting. For me, I mean, I'm not a psychiatrist yet. I mean, there's still so much to do, so much to learn. But like the journey for me definitely started when I was like, maybe there are some struggles within me. Maybe I should study this a little bit more. So it then became like the whole advocacy thing. But it's very nice. I mean, your kids must be great. Bullying at school must not happen with them. They must be like, my dad, he knows mental health. We're not letting this happen. Amazing. So now that we know a little bit more about you, I'm really interested, and this is the main theme I kind of wanted to discuss. You're leading the implementation of the alcove centers. And by the way, shout out to Dr. Sky Barbic. She's recording an episode with us she's a professor from University of British Columbia, and she shout out at alcove centers as a way of innovating youth mental health care. So shout out to you, Sky. But can you explain a little bit more about the core principles of this model and how it's tailored to the needs of young people? So alcove, what's that?
So, for me, it really began in terms of an interest in looking at other ways to develop supports for young people early. There's all this data in the United States that says that half of all mental illnesses have their onset by the age of 14. But and everyone nowadays is very good at quoting that data, but we haven't been very good at actually creating those programs and ways of identifying those young people, half of whom are having these issues early,
Yeah.
linking them to service, right? So people know the data, but they don't really do anything about it. And so, for me, it's been about well, how do we actually create, these public mental health models for early detection, early intervention for young people that are having these issues, and link them to early service, because we know that, early intervention for mental health issues works just as well as early intervention for any other medical condition.
Yeah, yeah.
Yeah, right. And so, for me, it's been about how do we create these early models for young people to get care. And, I started working in school mental health initially, with a focus on trying to, work in school settings, and people talk about schools as, where the kids are and how we should put services in there. And so for many years, I was a director of school mental health programs in New Mexico, worked in school-based health centers for 16 years, and really was focused on supporting those services for young people really in an integrated way, and linking primary care with early mental health care in school settings, and trying to create places in schools for young people to get help, and then to work with school partners, school health professionals, school mental health professionals on, identifying kids early and linking them not only to health and mental health services, but the appropriate educational services that they would need. And I really started to find over a period of time that there were still some challenges in school-based work. There were a lot of kids and families that didn't necessarily want to share all their problems with people at school because they didn't trust what they would do with them and how they would handle them. So these issues of informed consent and confidentiality became really important issues in terms of school mental health. There were principals that would turn over, and the new principal would come in and say, well, it's great that you want to focus on mental health, but, that's not what schools do. We're about education. And we don't have time or interest or money to focus on the health and mental health of our students. Thank you very much. We don't really need your services. And then there would be issues of space, and how do we find a room even when space is so tight in schools, to have a place to even see the students in a consistent and supportive way, and an environment that's comfortable for them. And then we have vacations and summers off from school, and lots of breaks in terms of service access. And so for me, there was a point where I wanted to go out and try to find other places and other means in addition to schools to be able to find spaces for young people to still get early support in the community. And so that's when I started learning about these other international models, like the headspace model in Australia, right? And, when we're not talking about the meditation app, we're talking about the clinical programs for young people that really started there quite a while ago now to create places in the community for young people to come in on their own or with a friend for early mental health care. And, there were places that really were designed by young people that had youth voice, very involved in the development of them. And so, I had a chance to see that model. We got some funding to explore the feasibility of bringing that model to the United States. And so we work closely with the Headspace partners to, think about what it would take to bring that model to the States. We are the only country, I think, right now doing this work that doesn't have national health insurance, which makes it really complicated for us financially and for sustainability. But the idea was to create a place in the community that very actively has the voice of young people at its core, that could create a safe and comfortable place for young people to get early mental health care. But I think based on my experience in terms of school-based health centers, felt like linking to primary care still was very important. Having peer support for young people so that they were comfortable with the staff and had other young people they could talk to or learn from about accessing care or addressing their issues. Creating places for supported education employment, to think about jobs, to get strategies for being successful in school, or thinking about a next phase of school, or do I want to go get a job, and how do I do an interview, and how do I do a resume, and how do I apply for a job? And then early treatment for addiction was an important piece. And then, so for us, it was really about creating these comfortable spaces where young people could get these core services, but then also be able to have other services they might need be available there too, whether it was like housing support or youth wellness activities or, other job training programs or other services, and really seeing these centers as potential like youth hubs for multiple services that also have clinical capacity as well.
You got it. I mean, it's very nice because I remember it kind of like points out two things for me. I very often hear the importance of school-based interventions, and I completely agree with them. But it's very nice to hear your perspective on the challenges to actually do the school-based interventions, because it's not as straightforward as it seems. There are many, many practical challenges into really making one intervention that works and really supports young people the way they should be supported. And the second thing that really, it's kind of like a highlight for me is how this services kind of expand the support system of young people. Because I remember when I went through school in high school, it was not that long ago. Just kidding, it was a little bit long ago. The scan is already 25. But I remember I used to have some friends that they used to always come and talk and have like these deep conversations about the struggles and main things that were going on. And some people don't really have a place to go, like a safe place to talk to. Maybe their caregivers, their parents, their family is not such a safe space for them. And they couldn't find this place where they could really find support. So this is really interesting. And now really think about Alcove and all that you've been doing and all that your experience has shown to you in terms of designing and implementing those mental health services for young people. What are must-haves? I mean, if someone that's like, okay, we really want to start to support youth mental health and we're going to start creating such centers, what would you say are must-haves?
Well, it's a really good question. And I think one of the things that I have to sort of back up and talk about a little bit is, in my training in child psychiatry, you know, I really wasn't trained in, most of the traditional models. And, I'm an, I'm an old guy. And, and I trained a long time ago now. But I think even in terms of the training we're still doing in psychiatry and child psychiatry, at least in the States, we really haven't fully broken away from this idea that in our role as physicians, we're supposed to be these experts and we're supposed to listen, do an assessment, come to a diagnostic formulation and, make a treatment plan. And, one of the things that has been important for me to learn over time is the importance of having a little bit of a different approach. And, I had a chance to work for a number of years in early psychosis related work. And you mentioned that on my bio about doing that work. But what's been important for me about that work has also really been learning from people with lived experience and learning about the expertise of people with lived experience and really seeing my role rather than being the expert that's supposed to tell someone what to do and but to really be a partner in helping people make decisions about their own care. And, that is a really different frame from how I was trained, right? And maybe even how you were trained at this point, I don't know. But, so what that has led me to has been a sense of the importance of really appreciating the voice of young people in a different way and really sort of appreciating the value of, understanding the importance of working with people with lived experience. And, within the US, there's this organization, NAMI, the National Alliance on Mental Illness. And I think that's the first time I heard, this whole discussion, like nothing about us without us, right? And, but at the same time, a lot of the people in NAMI were actually parents of people who were dealing with mental health challenges. They weren't those individuals themselves, right? And so part of the issue really then became, how do we ensure that the voice of young people themselves are really taken into account, that the models we're developing really come from their own sense of what works for them and what will work for their friends and colleagues as well. So I know this is a long-winded answer to your question, but I think one of the things that's really important and at the core of this is for us, these youth advisory groups and ensuring that youth voice is at the core of developing these programs right up front, right? And so, that to me has sort of been a revelation for me. It's been really new and really important. I mean, it's not as much new now, but it's been something that I've grown to learn about and really appreciate. And so, to me, when I started working on getting the first alcove centers open, and we didn't have the name alcove at that point, that came later from our youth advisors, right? When I was asked, well, what do we need to kind of get this model moving? The first thing I said we needed was, someone who could be a youth advisory group coordinator, because the first thing we needed was youth voice. And we needed youth involved to tell us what the model needed to look like, to tell us what it needed to include. Ultimately, the young people developed the name and the design and the core services and the location and became involved in hiring the staff and are becoming involved in the evaluation. And so, what these programs have to have is sort of youth voice and youth role at its core. And, that's a critical first element, probably beyond anything else,
Hey, everybody, we can wrap up the podcast. I think our mission here is done. The main message has already been delivered. If you got this part, you got everything. Okay, let's do it. Steve, that's it. We're done.
Come on. I really enjoyed talking to you, Vinny. Thank you so much. I hope you have a great evening and great weekend.
That's like the core message of everything. Like nothing for us without it. I mean, Yes. And by the way, if you're watching from home, stay tuned because we're gonna have an episode just talking about youth advisory groups, youth engagement, young people at the center. We're really gonna talk about how to really make this happen because a lot of times, more often than not, I really hear a lot of struggles in, okay, how do we do that? And we're gonna get there. But that's very nice of you. I mean, completely agree with everything. And it's very nice to know that now this is being more and more practiced and this is being more and more valued, how to really engage people, not as like consultants and like externally in just one small portion of the process, but throughout the whole design, implementation, throughout the whole process itself. And from your perspective, what do you think that's not currently practiced as much, but we should invest more in terms of youth mental health services? What have you already in this journey found out, oh, that's very nice. I mean, this works, but people don't usually do that much. Maybe we should start doing more. Is there such a thing?
Well,
okay, tricky question. Maybe you can have 10 more seconds.
so I'm trying to think, because there are so many things, right, that I think are really important to be developing, right? I know that, for me, one of the other things that we're also really trying to work on related to this is, how do we develop training models for young people, to be able to learn how to actually support each other more effectively as well. One of the things around all this work is that we don't have enough of a youth behavioral health workforce. We don't have enough people to take care of all the need that we have, certainly in the United States, and I'm guessing and not in Brazil either, or other places, to have enough people to provide the care and support people need. So, one of the things that we've been exploring is, how do we better create peer-to-peer curriculum and train young people to better support each other. There are programs that get implemented around suicide prevention in schools in the States that really try to find those leaders of the different networks within a school and identify them and give them extra training so when their friends come to them for support, they have some skills to know how to respond to them and link them to a caring, trusted adult for more support, so I think finding ways to build that leadership. And, one of the things that's been interesting for us as we've been working on the youth advisory groups for Alcove, we're starting to see that some of those youth advisors, especially some with lived experience, end up getting hired by the Alcove centers as peer support specialists. And then as peer support specialists, they end up thinking, maybe I'm really interested in this psychology or mental health stuff. Maybe I'll go back to school and learn how to do it. And then they may go to a 2-year college to get some extra training in counseling. And then they may decide, I'm going to get a full degree in this. And so, we're finding that even starting as youth advisors and giving young people early skills starts to actually become a behavioral health workforce career ladder. Which was something we really didn't expect either when we started working on this model. But, that's becoming another important part of this process as well. So I think giving you skills to support each other early is an important piece. I think giving people resiliency skills, and helping people learn how to take care of themselves. One of the things that is not specifically Alcove related, but, we have some of our alums from the Alcove Youth Advisory Group, started a group called Good for Media.
Yeah, talk about it. So good.
So, Good for Media is like a peer network of young people that are supporting other young people in how to use social media in ways that are safe and comfortable and support their own mental health and wellness. And they've developed guides for how do you deal with comparison on social media in a way where you feel good about yourself. They've developed a guide for parents on how you can talk with your kids about social media in a way that it can be a positive experience. And as a parent, you don't have to just say, I don't want you on your phone anymore, right? or, or working, one of the ones they recently did was how to tolerate reading the news and still feel good and safe, And so, um, having ways of sort of addressing a lot of these issues and like our colleagues in Australia, Joe Robinson developed the chat safe guidelines for how to talk about suicide, you know, um, using social media in a way that won't increase risk or contagion or risk your friends dying by suicide. So having those models, also becomes really important and helpful as well. So I think looking at how to develop media literacy around social media is a really important piece. And I think some of these countries or states that are doing these blanket statements of, you can't be on social media until you're this age, or, even in our country, we have our Surgeon General being very worried about social media as being this negative influence on young people. And the data is not really clear that that's necessarily the case, but that's what he's promoting. And I think, for many young people, our LGBTQ community and others, social media becomes a lifeline to getting critical support and ways of linking to other young people who people can identify with, can get support around the care that they need. And so cutting that off can be really dangerous for young people as well.
I mean, already plugging, if you don't know Good for Media, just type it on your internet browser, Good for Media, and check them out. It's great. And it's very nice that you said that, because usually people paint a very bad picture of social media. But as you said, data shows a more nuanced picture. For specific communities,
Absolutely.
there are many positive highlights. They can expand their support network. They can connect with friends that are, maybe a little bit far. So we really need to be careful not to just be it's either 100% good or 100% bad. We really need to make sure that we're offering the assets for people that need it in a way that actually benefit them.
You're a very wise man, Vinny.
I'm just quoting you, man. And okay, I really need to move. I want to move to this other question and kind of like thought. Mental health not historically, but sometimes is very siloed from general health, from like physical health, and especially in services. So usually, for instance, I've seen places that you go to the emergency department seeking for help, and they have like every specialist except for a psychiatrist. And this is not uncommon. I mean, there tends to be the separation, especially in services. Okay, the service focus on mental health and the service focus on physical health. And this is very important for young people, because it's very important to have one place that can actually support the young person throughout their whole development process. So how, in your experience, how has the integration of like behavioral mental health care with primary care settings happened or has been happening, and how does it actually work?
Well, when I was in training, I think my real first exposure to integration really of services, was in school-based health centers. And, I remember before that being in medical school, being on the surgery rotation and, really seeing terrible conversations happen with families. And, when they were giving bad news or something would happen, or, the surgeon saying to me, hey, Adelsheim, you want to go into psychiatry, you go tell them they have cancer, right? Because, the surgeons wanted to cut at times and they didn't want to often have those conversations, or they weren't often comfortable in terms of how to have them, right? And so, part of the issue I think becomes, one, we don't really build in training, for our primary care providers actively in how to think about mental health, how to support young people with mental health issues. And we know that for people between the ages of 10 and 30, their primary morbidity, if they're having a problem, is usually a mental health related issue, right? I mean, much more than it. Most young people are healthy, or they have maybe some unusual thing, but the mental health challenges really begin during that period, and that is the primary issue. And so, for me, like I said, working in school-based health centers during my training, I was sitting side by side with family practice docs or pediatricians. I would be able to go into the room with a pediatric resident or a family practice resident and work with them on how to have this conversation with this young person about, were they really having suicidal thoughts? And, we could walk through together how to assess that. Or, was this young person really hearing voices and starting to hallucinate or becoming paranoid about, were those young other students across the hall really talking about them or not in a negative way? And so being able to start to have those interactions early, for me, it was a chance to learn how to support my primary care partners in learning how to have those conversations, how to take what I was learning and share it in ways that could be positive and helpful. And for the young people, being in a school-based health center as opposed to like a mental health clinic made it less stigmatizing to be sitting in that waiting room. And sometimes for young people, depending on their cultural background, it wasn't easy to walk into the mental health provider's office, but they could go into the primary care provider's office, they could talk about their headache, or they could talk about their stomach ache, or their other somatic complaint. And by the second or third visit, you could get to the underlying mental health issue as the primary care provider, and then walk that young person across the hall, introduce them to the therapist, and then really do a warm handoff. And at that point, maybe allow the therapy to start in a way that couldn't have happened if the young person was told, well, you got a mental health issue, you need to go talk to the shrink over there, And so, that linkage was really important in helping our primary care partners feel more comfortable addressing mental health issues and feeling like they had backup and tools also, became really important as well. And so as we started working on developing alcove centers, being able to have the co-location and the integration not only was important to me, but frankly, our youth advisors really thought it was critical to be able to have all of those services together, whether it was for general medical issues or family planning services, being able to have those in one place, they really felt was an important priority. And then so over time, being able to then have the capacity to work with primary care partners around these issues has been, a wonderful experience and really critical for development of our programs.
Amazing. So, tip to listeners. If you can advocate for something, advocate for integrated health services. If you have time, tweet it out. Talk to your friend. I don't know, just do something that helps us create more integrated health services. It just makes everything easier. And it's crucial. Crucial. From my experience as a GP, I'm not even sure if I can say GP, a physician that works with general medicine. It's so intertwined. There's so much correlation, and it's so crazy to see sometimes how things are so siloed. We definitely need more integration. Guys, help us out. If you're watching, help us out. And Steve, I don't know if you know, but you're in a show. So we have props, my man. We have props. And this next question for you guys that are seeing the video, come on, I brought home. We need to value this. I really carried this globe to the studio today just for this question. So please value this work. This is heavy. I brought this for you. You that are watching, this is for you. Okay, so Steve, my next question with this globe over here that turns off and on, no, on and off, and on and off, and on and off, it's a very good question, I think. Maybe you're not like as much, but I really like this question. how to take into account socioeconomic and cultural diversity when developing mental health services and programs for young people. Because I see guys, it's so connected. Globe question, okay, enough. More often than not, I see people talking about youth services and youth mental health services as young people were a group, like a homogenous group, as if young people were this one thing. But young people are like this huge population of like millions and billions of people that come from different places, different cultures, different socioeconomic statuses, different. So how do you take into account all these differences when creating those services? What are the best practices? Give us the best practices.
Well, Vinny, I guess I have a couple thoughts related to this. One is, back to this sort of core youth advisory group, right? And the idea that if you are creating a youth advisory group that is representative of the diversity of your communities, in multiple ways, including the cultural diversity of the community, then, you will be developing programs that the young people of your community resonate with. And so, as we're looking at, for example, alcove development, we have a statewide advisory group that is broadly geographically based, but also culturally diverse. And, I was just visiting in the northern part of our state with a number of our indigenous partner programs. And, one of the things we're talking about is like, what does an alcove center look like in an indigenous community, right, in our state? And what does it look like in terms of how is the design different? And what's different about the services that are delivered to young people based on meeting the cultural needs of that community? And, what is the role or even the definition of family in the context of different cultural groups? I think there are major issues around stigma that come up in different cultures and communities in terms of addressing mental health. And how do we work within each community to address those issues in a way that resonate with the young people, but also allow their families ultimately to feel comfortable even being involved in discussions about mental health and wellness? And it's going to certainly vary from culture and community. I just had a visit to a nation over in the Pacific Rim area. And, it's a community and a nation that doesn't have a lot of access to physician care. But they had a very active youth advisory group made up of representative youth from multiple schools, multiple community programs. And they're really trying to think of ways to support each other. And so even going back to the issue of, what does care look like where you don't have, a lot of physicians, for example, or even a lot of nurse practitioners or others, how do you then build up the capacity of young people to support each other? How do you build a model of community mental health workers like you see, being developed in India broadly across the nation, or in Alaska broadly across the nation because of the rural and remote nature of the communities there, and doing that in a way that supports the cultural core of the community and addresses mental health challenges in a way that resonates with people in their home communities. So, part of it is still building out this capacity through community support and building this other broad network and supporting the natural expertise, of the people in each community to utilize all the resources that are there, and then be able to make the linkages, whether it's through a telehealth connection or training programs that can help. I was trained at the University of New Mexico, and one of the programs that was started there was Project Echo, which is a process for training people initially in rural and remote areas with support from other experts in how to address complex medical issues. And it was through live connection, getting some didactic training, discussing a case together, and then helping the rural and remote providers get a higher level of comfort with addressing these more complex medical conditions. And it began around the treatment of hepatitis C, but now has taken off into a global phenomenon. And you can look, in most countries, there's Project Echo models to support whatever degree providers have in, their communities and their countries, and in being able to get support and access to care and enhance their own expertise to be able to address the complex needs in their communities.
Yeah. Guys, can you hear the importance of really engaging? I mean, I'm I can sense that I'm going to be repeating that a couple of times throughout this whole season, but it's really of an utmost importance of engaging the community that you want to serve in the design of services that you want to provide. How do you make sure that you're taking into account culture and different diversity within the population that you really want to support if you're not talking to them and if you're not making them a part of the whole design, a part of the whole implementation, a part of the whole process? So again, this message stands out. If your passion or if your purpose or if you're really just trying to support people or one specific group of people, make sure that you really talk to them first and make sure that you really enable them to be a part of the process. Make sure that you bring them to the table and make sure that the table is ready for them to be brought, so that everybody has a say, everybody can really work together in a collaborative way to make sure that we really come up with interventions that really work and support people, because at the end of the day, that's why we're here. Okay, the energy has been a bit more deep. Now let's go back. Let's go back to it. Okay. When we think about the services, we cannot not mention policy, right? Because for instance, Brazil, most of our population relies on our public health system, which is great, by the way. Many, many good things to talk about Brazilian public health system. And the public health system per se, not only the public, the private as well, really relies on policy, right? So in your opinion, what policy changes or improvements are needed at the moment to create a more comprehensive and effective mental health support system for young people?
Well, I do think, right now we have this brief window, like in the States, where there's this discussion of a national youth mental health crisis. And we have this brief window where we're seeing some resources go to youth services, going to school mental health. What I'm struck by is even in the state that I'm in now, there's money going to these programs, but there really isn't a lot of support for infrastructure, a lot of support for what these school districts and these communities should be doing with the money. So then, one of the things is you can throw money at a problem, but without sort of really, working with the community and putting an effective plan and program in place that really meets the needs, you can kind of be throwing money away. And so I think the resource is important, but the support around how to utilize the resource is really important as well. I get the sense that also we really, we've had a crisis in terms of youth mental health well before the pandemic, but we're only talking about it now. And, and I go back to the point we sort of were making at the very beginning of our discussion. If we really feel like half of all mental health conditions start by the age of 14, it really makes sense to build out that upstream system much more actively and effectively than we do. And most of our dollars are tending to go to people with serious and persistent mental illness and, later support for them. But we also have really good data through doing work in early psychosis, that early detection, even for people with early signs of, psychotic illnesses, really can stop their process or delay moving to more serious psychiatric conditions, can prevent hospitalizations, can keep people in school and working. And so training more people to do that upstream work, making it easier for people who want to get training and working with kids and adolescents to be able to do that without having to go back to school for extra years and extra loan payments or other kinds of things, so that we really are building out the child and youth workforce in a way we haven't done yet and make it easier to do that, and then be able to sort of build on those services more effectively earlier. I think we just haven't done enough, and we haven't built the upstream system in a way that needs to happen, and we haven't really, as much as you talk about the great public health system in Brazil, I mean, my question would be, and how great is the public mental health system in Brazil? And to what degree are we integrating mental health with public health and really ensuring that our public health networks really include and incorporate mental health and wellness into their surveillance, into their early intervention? Because we usually think about it more in terms of communicable diseases and other issues like that, and not in terms of, a public mental health approach to care.
Definitely. Yeah, we still have a lot to work on in terms of our public mental health system. There's definitely many things we could definitely work on. Igor, call our Minister of Health. We have some things to discuss. I mean, for reals. But great things at our public health system regardless.
I'm sure.
I'm a fan. And let me kind of like reply your question with $1 million question. We're kind of getting to an end of our show, but we do have $1 million question for Steve. See, this is a show, man. I brought like props. I brought a globe. I mean, we're working on things. It's happening. Okay. What does it mean to have $1 million question? Does it mean you're going to gain $1 million after this question? Of course not. But you get the idea. I mean, I don't know. Maybe, sponsors, if you're hearing this and you want, to kind of like make sure our guests can really receive $1 million, we're up for it. But my question for you, and my question for you, listeners, just if you want to answer this question, please DM me on Instagram. Just follow our page, by the way, is at Hey Doc Podcast. Hey without an H, because we're in Brazil. It's EI, okay? My question for you is, I see what has to change. Like you've given many examples of policy changes that could be in order to make sure we have a better system for everyone. But my question is, how can different stakeholders contribute to this change? I can see from the perspective of a policymaker. Okay, if I'm a policymaker, I can really propose this and vote and all of this. But if you're a healthcare provider, or if you're an advocate, or if you're a young person, how can we actually contribute to this?
So, a couple things. If you're a healthcare provider, I think one of the things you could do is help contribute to breaking down the stigma around talking about mental health issues and about addressing them, and ensuring your interactions with your own clients, you're asking about mental health issues, you're giving them space and letting them know that it's comfortable and appropriate to talk about mental health issues and challenges, and be building it into your screens, your assessments, and then being able to maybe even get training yourself and more effectively how to address these issues. But I think we all, first of all, on some basic level, regardless of what our role is, we all have an obligation to break down stigma and discrimination in terms of access to mental health care. We need to be building it into our training programs for our medical students, and we need to be building it into the service delivery that we have. So we all have an obligation. And if you're a parent, I think we find in our younger generations in the US are a lot more comfortable acknowledging their mental health challenges and talking about getting help for them and going to a therapist in a way their parents would never talk about. And so one of the things we want to do is how parents normalize mental health conversations within their own families. We see lots of parents who sort of feel like they have to look perfect to their kids, but sort of acknowledging the mental health issues within our own families is a really important thing to do, and making it comfortable for our kids to not feel like they have to be perfect, that they can have mental health issues, and that we in fact did as parents, and we still do, and get rid of the shame around that. So I think that's one really important piece. I also think, as we've been talking about, creating opportunities for our advocates and policymakers to not assume that they know what young people need, but to create spaces for young people to tell them, and for them to really lift up the voices of our youth rather than sort of assume they know what's best for our young people. And so creating spaces where our youth advisors and our youth advocates can speak directly to the policymakers, can speak to their legislators, can share their experience and what they think is needed, and have that happen in a respectful way that then ultimately is incorporated into care and policy, is another critical piece. And I think if you're a youth, I think one, being able to support each other becomes a really important piece. Being able to support your friends and colleagues in talking about mental health issues, in supporting your friends who might be at risk and getting comfortable, getting care, and linking them to care if you're worried about them more directly, and taking the opportunity to do that also really matters. And then also, if you're a young person, having the courage to sort of talk about what you think is needed and trying to find those venues, and but being patient with all the rest of us adults, when we're not always listening the first time or the second time, but keep coming back in to educate us, I think, is probably an important thing to think about if you're a young person too. We have to hear something a bunch of times sometimes before we're willing to listen, and you might have to be patient and share it with us a few times before we're ready to go with it.
Yeah. I don't even know if I can ask anything else. I mean, I think I think this is it. I just want to reinforce what you've just said. Just really want to highlight that. If you kind of like want to help out, but you don't know how, maybe what Steve just suggested really helps a lot. Making efforts to normalize that people don't necessarily need to be perfect. If you're struggling with something, that's okay. Reach out, talk to people. Don't go through things alone. I think there's a lot of pressure everywhere, in schools, academia, work, where young people are, social media, that everything has to be great all the time. And if it's not, something's wrong. But that's not how, at least for me, that's a personal opinion. That's not a medical opinion. That's not a medical thing. That's my personal, Vinny's opinion. Life's full of ups and downs. So if we can facilitate alleviating the pressure of, hey, we don't have to be perfect all the time, that's definitely a win-win situation for everyone. And Steve, my last question for you is actually a question from the audience. Just kidding, we don't have an audience for my sister. But we'll have an audience at some point. It's coming, I can feel it. You've already given so much advice on many, many things. But if you had to choose one, if you had to give one advice for a young person who's actually starting to navigate these conversations on mental health and starting to get involved with advocacy and wants to get involved with like local health centers, what your one advice would be for this young person that's actually starting the whole process now?
I guess I think one of the things that might just be important is as you're going to jump into this work, being sure you have some support of your own, and that, because I don't think it's easy. I think it takes a lot of courage to jump in as a young person and be a part of these conversations, to often acknowledge our own mental health challenges and be willing to put them forward and get, support. I think if you're going to jump in, I think, realizing that things often don't change as quickly as we would like them to, that not everybody just wants what's best for young people. And I think in order to be able to tolerate some of that, being able to have a support network or to sort of get involved in this work with a friend, so you're doing it together, will decrease a sense of isolation and a sense of risk, and allow for it to be done really in a partnership with at least one other person from the beginning. So I think being sure you can take care of yourself and don't feel pressured to share too much too quickly. And, and also find adult allies. I think there are people that one can trust who can be careful and thoughtful in supporting young people through these processes. And so finding those adult allies is also pretty important too, as quickly as one can.
Definitely. Steve, thank you. I can't thank you enough. This has been such a great conversation. I've learned quite a few things.
Well, thank you, Vinny. It's been an honor to be able to visit with you, and I always learn so much from you as well. And so thank you for giving me the chance to be here with you today. It's much appreciated.
Definitely, my pleasure. If you want to check out Steve's work on Alcove is ALLCOVE. They have a website with more info if you got inspired by this kind of center and this kind of work. If you want to learn more, make sure you can check it out on the internet. Make sure to follow us on Instagram, because I just said I had a question for my sister, but in the future there will be questions from you guys. So you can always send questions on Instagram or find us on social media. It's at Hey Doc Podcast. Again, we're in Brazil, so Hey Doc's EI Podcast. And it will be a pleasure to hear from you guys. Thank you so much, Steve. Again, thank you for being here with us today. And if you like the podcast, please don't forget to share with your friends, with your family, with your community. Because I genuinely believe that when people have a purpose and work together, they can really step by step change for better their communities, cities, countries, and maybe, who knows, the world. Bye.